In the year 2016, opioid deaths were 5 times higher than they were in 1999. It's a national tragedy, and it's become a daily national topic of conversation as well. We're bombarded with news, statements from politicians, and state legislatures, as well as federal legislators. So why did we create this report? It's because there's such an overabundance of information out there, especially legislation that's being generated, and it's overwhelming. Each state has tremendous variability from one to the next in terms of what types of legislation they're passing and the approaches that they're taking to try to tackle this very important problem. Yet healthcare executives and government leaders need to understand the trends and understand what's happening at the state level in order to prepare for these new mandates and how they will impact their patients and prescribers. This report is chock full of maps and tables, charts, things at the executive level, as well as key trends with deep analysis in terms of what's the importance and impact of these trends, as well as more nitty-gritty state-by-state details in tables in the appendices. 1 in 4 people who receive an opiate prescription, excepting cancer patients, 1 in 4 struggle with addiction. So the biggest trends we're seeing are those that impact the initial writing of that prescription between patient and prescriber in the physician practice. So the trends are things that impact what prescriptions actually get written, like states are mandating quantity limits, particularly for a first prescription for an opiate-naive patient. They're also mandating e-prescribing to help prevent fraud and abuse. And they're also requiring practitioners to access the patient's controlled substance profile prior to prescribing. So healthcare leaders need to understand these trends and the specific actions that are being taken in order to be compliant and to inform their future efforts. We believe this report goes a long way towards summarizing the trends, their impact, as well as providing the detail that is needed for these decisions.